Today we're going to be talking about managing experience modification rate and return to work. My name is Michael Hartnett. I'll be your facilitator today, and let's get started. So we'll start the same way we always do and tell you about the FCA Safety Helpline. If you have any questions related to safety, please do not hesitate to reach out and call the Safety Helpline. So 844-414-7233 is the number. And if you call and ask a question, a safety professional will get back to you as soon as possible. Right? So generally that's me, or I'll talk to somebody else in my team that has the most knowledge about the topic being asked about. All right, so what are we going to be talking about today? Well, experience modification rate. We're going to start with what is EMR, right? Very important that we understand what EMR is and how they go about finding what that EMR is. Then we're going to talk about managing that EMR, that experience modification rate. Then how you can look at clinics, right? What steps can you take to lower that EMR? And then last but not least, we'll talk about return to work. And having a return to work program is very important, especially when we're talking about EMR. So let's get started. What is EMR? EMR is experience modification rate. It's a number used by insurance companies when rating one company against other companies within the same industry. So when the insurance company is trying to decide what to charge you for your workers' compensation insurance, EMR is the number they calculate to determine what that cost will be. So why does EMR matter? Well, obviously, it's going to impact the costs of workers' compensation. But that's not all, right? It's also going to impact your reputation. Many general contractors are only allowing bids from subcontractors that have an EMR of 1 or less. Now, 1 is industry average. So if you have an EMR of 1, then you're going to have the same costs and the same incidents as average for your industry. And it's broken down industry by industry using the NAICS code, North American Industrial Classification System, so that they can put together like with like and determine what those costs are. Right. So the EMR can really impact morale and retention of your employees, not because they necessarily know what your EMR is, but because EMR is generally a pretty direct reflection of your safety record, right? And this is going to impact your employee morale and retention. All right, so how do we determine what that EMR rate is? Well, there's many different factors that play into it, but the most basic calculation comes down to the actual loss, right? How much was spent on workers' compensation over the last 3 years versus what they expected to lose over the last 3 years. So the cost spent for workers' compensation, right, on claims is really where it comes down to. So that calculation is actual loss over expected loss. So it looks at the last 3 years. So it doesn't drop and raise as according to that last year, right? It takes years for a bad year to come off of your EMR. So one example would be you have an actual incurred loss of $150,000 in payouts to your workers' compensation claims, right? And the expected for the industry average is $120,000. So by doing that simple calculation, you know that the EMR is going to be right around 1.25, right? So what is that going to do? That's going to impact you so that you may not be able to bid on some jobs, right? Lose some of that competitiveness, not be able to get the work, which is a real challenge. In addition to that, EMR is generally a multiplier for insurance costs. So if the average company is paying $1 million, right, then you'd be paying $1.25 million. So as you can tell, this is really impactful. So what do we do about it? Well, we have to manage our EMR. And managing your EMR is very important so that we can make sure we save that money, right? Lower that EMR cost will save you money on your workers' compensation, and it will make it so that you're able to bid on more jobs, right? The industry average is always 1.0. That's the benchmark of what we're doing. And the higher your average, the higher your premiums, right? So if that EMR goes up, your premiums are going to rise with it. However, if you can lower that EMR, if you can lower that EMR, you will lower your cost of insurance. It'll also make you more competitive for bids. General contractors definitely look at your safety record, and your EMR is one of the key measurements that they utilize. So EMR is always based on the previous 3 years claims data. We add that together and find out what that EMR is. The highest number of claims, the higher the pay. That's really how it works out. And we have to work to manage those claims, right? So you want to double check with the insurer to make sure they're not rating you higher than they should. This number can be impacted with discussion and negotiation with your insurance company. So since the insurance carriers are going to price your EMR, right? They're going to set your EMR based on what they expect your losses to be going forward, right? So here's a EMR statement, and in it you can see the actual losses, right? Expected losses versus actual losses, and that is really going to impact what we end up with our experience modification rate, right? So when we come in with 264 as our expected loss, 225 as our actual loss, then that's going to drop our experience modification rate to 0.95, right? Below the industry average. We really want to make sure those losses stay below what the industry average is, right? We want to be better than the industry. That's really how we impact our EMR. So there's many different ways that we can impact our EMR. But one of the most important is to deal with clinics, right? When we're talking about the occupational health clinic that we're going to, oftentimes the closest occupational health clinic is not necessarily the most best, right? We don't necessarily want to send them to the closest occupational clinic, but one that we've worked with, right? How do you choose your clinic? If we're going to the closest one, then sometimes we're going to end up going to the local emergency room. Now, understood that if there is an emergency, the emergency room is where to go, right? No question, we're not going to call 911 and ask them to take them to an occupational health clinic. We're going to take them to the ER. But for our less serious injuries, we can really impact that by dealing with our clinic, right? So if you have a clinic you're working with, when's the last time that you audited them? When's the last time you've gone and have a conversation with them? Have you created your job descriptions and provided it to your occupational health clinic? If they have a better understanding of what work is being performed, then they are better able to determine whether it's a restricted injury, a light duty injury, or a return to work. Right? So it's important that we have this communication, that we build a relationship with our clinics. Right? Have they walked your job sites? Now, this is pretty challenging when we come to construction companies, but we may be able to build that relationship and see if they can come and see some of the work that we do so they have a better understanding, right? Is it affiliated with a hospital or is it occupational health clinic, right? Is it part of that workers' comp clinic? And this is very important because a hospital affiliated clinic is likely going to start with a prescription to physical therapy because they own the physical therapy business, right? When they own that practice, hospitals often funnel work to themselves to increase profits. Right now, this is not true in all hospital situations, but it is something that we want to be wary of. By going to an occupational health clinic that is not in line with another business that or does not include physical therapy, occupational therapy, and other businesses, then we can stop that business sharing, right? We're less likely to prescribe physical therapy unless it's needed. And that's really the benefit of going to an occupational health clinic and having that relationship with the occupational health clinic. So if you do have an occupational health clinic, and I know we said when was the last time you audited? Well, an audit really is talking to them and asking them some questions. And we have a list of questions here of what can be discussed with the doctor to really understand what they are interested in, what their knowledge base is, and what their philosophy is in regards to workplace injuries. Right. So that's actually the first question. What's your philosophy in regards to workplace injuries? Right. What we want is to get the employee back to work in the quickest, most healthy way. Right. So how aggressive are they on return to work? Return to work is very important. And there's things you can do to make this much more in line. And we'll talk about that a little bit later. But we want to know how aggressive they are about getting an employee back to work. If it's not an occupational health clinic, then a hospital emergency room is not going to be concerned about return to work, right? They are going to give the most conservative advice possible to make sure that they don't have to be concerned about anything, right? So that means prescriptions, that means time off, and that may very much impact the cost of your claims, thereby driving your EMR up. So, how much exposure have you had to workers' compensation cases? Right? This is very important to know. How are your employees trained on injury classification? Right? As safety professionals, and those who are dealing with workers' injury, right, our record keeping knowledge needs to include what is a recordable, at what point in time is a lost time restricted. And this information is not known in most emergency rooms, right? But if you go to an occupational health clinic, they should be training their doctors on what constitutes a recordable incident instead of prescribing 1,000 milligrams of ibuprofen, which is not over the counter strength, would 800 milligrams be sufficient, right? If they can subscribe under or prescribe under or at the over the counter level, then it doesn't trigger a recordable, right? So making sure they have that knowledge is important. And an occupational health clinic should have that knowledge. But how often are they training on it? Do you have an example that you can show of the type of training that they are receiving? Right? Find out what they're going over, what that training involves. And would you be willing to come to one of our sites and look at what we do to better determine whether whether we need to have a work restriction or not? So other questions we can ask, What types of trainings do your doctors, nurses, physical therapists receive in regards to work compensation? How often, right? So not just the doctor themselves, but everybody that's involved with that. We really want to know where they're trained, what level they're trained, and how often they're trained. What does your back to work rehab program incorporate? Right? If they have specific programs related to rehabbing workers that are out of work, you want to know what those are. And would they be willing to fill out our modified duty job requirement evaluation of physical abilities form before sending employees back to work on modified duty, right? We want to have very specific instructions on what an employee can and can't do. A, a doctor saying that an employee is on light duty without really clarifying what that means, it really limits what you can do with that employee, right? And getting that employee back in the job site, back to work sooner, is one of the most important things we can do to impact EMR after preventing those incidents, right? And we've always are talking about preventing incidents. Obviously, that is everyone's first choice. But when incidents do happen, we want to make sure that they can work with us, right? Not to give suboptimal care, right? That's not what we're looking for. We're not looking for a doctor that will agree with us and be against the patient, right? That's not it. What we're looking for is a doctor that understands what triggers what related to record keeping and OSHA laws and workers' compensation so that they can not be overly conservative in areas that are harmful to the employee and to the company. All right. And asking them if they think they can work within your company's system is important as well. You can ask your doctor, what tests will you perform at the site? If you're asking for drug testing, right? What panel are they using? Are they using a 6 panel, 7 panel? Are they testing for opioids? Are they testing for marijuana? Right? Are they testing for quaaludes, which haven't been available for decades? It depends. We want to make sure we know that what type of testing they're doing because different tests cost different amounts. If you tell your clinic to drug test your people and they use hair follicle tests, that's going to take more time and cost more money than a general urine analysis, right? And also ask what type of after hour care, emergency care do they provide? Are they open on weekends? If we have an injury on a weekend, can we get somebody in at that point in time? Again, this can lessen the amount of time off that we have for those situations. Who will be our direct contact from your office? Right? You want to build that relationship with the occupational health clinic so that you can have those discussions. And if we have a workers' compensation course that goes in a way that you don't believe it should, you can have that conversation with the doctor instead of assuming what the doctor's doing. And that can pay dividends both for your peace of mind and also in the long run. If you disagree with it and you have a frank discussion with the doctor, maybe the doctor can explain why they did it, or you can explain why they don't need to be restricted at that level. And then the next time the patient comes in, if the doctor sees your point, maybe there'll be a change, right? So, and also how much advance notice is needed to send a patient in. These questions are really important to know how to utilize your occupational health clinic. So, company steps you can take for managing and improving your experience modification rate. You know, when we're talking about the construction industry and specifically the finishing trades, you really have to deal with high levels of physical labor, right? A high level of physical labor is very demanding, which makes light duty work more difficult to find and release to full duty work more challenging to get a doctor to fill out. We also have work at height. right? And working at height is going to be a concern for insurance companies, right? It has to do with why your experience modification rate is where it's at, what the expected losses are. And these are going to lead to the possibility of higher risk of workplace accidents. Now, EMR is based on your industry, so everybody in your industry has it, but you have to be aware of some of those things that are going to impact that, right? So first thing you want to do is uncover your risk. Determine where you have blind spots, right? You can have an assessment, by a third-party consultant, or you can go out and perform job site inspections and really get a good understanding for where you're having incidents, where you're having exposures to your risk, right? So conducting those safety surveys is really important. You want to look for gaps, look for where your exposures are at. And then you want to make sure that you've established accountability throughout the organization, right? Your foremen are accountable for what's being found in their safety surveys of their sites, accountable to not only find it, but to correct it, right? It's very important that we drive this accountability. And management needs to commit to safety. What does that mean? That means we need to make sure our frontline supervision understands that sometimes clients have to be disappointed in order to protect employees. Right? I'm going to say that again. Sometimes your clients need to be disappointed in situations where you need to protect your employees. Because as long as the choice is to be safe, unless we have to get this done, you will continue to have incidents, right? That's always going to be an issue with your incident rate. Implement those proactive safety steps. I know we talk on this call month after month about different aspects of safety where you can really dial in and try to improve. And it's important that you continue to implement these, right? And one of the best things you can do is encourage near miss reporting. Okay. Take those free lessons, because if you don't have a good near miss reporting program, if reporting of near misses or even incidents is not normalized, then you're going to not get that information off of the site. And the only time you'll hear about it is when it is too big to hide, right? When someone has to go to an occupational health clinic or an emergency room, that's when you'll find out about it, right? So we have to normalize that reporting, and not just incidents, but near misses as well. A good near miss program will allow you to capitalize on the free lessons that are happening on your site every day. And I guarantee you, you are having near misses on your sites every day. That is how it works, right? No matter what the industry is, we always have near misses. And unless we get that reporting in, then we don't learn those lessons until somebody is actually injured. And then you want to make sure that you're documenting what you're doing, right? You want to be able to have this information so that you can have a discussion with your insurance company. You can argue your EMR and ask them to lower it, showing that we've implemented this program, this program, this program, right? When they believe that you're going to have that lower rate because you've successfully implemented programs, you may be able to get them to lower that EMR. You want to make sure your report claims, right? You want to report those as soon as possible. You want to make sure that you're working hand in hand with your insurance company. You want to be as transparent as you can and make sure that you provide that necessary medical treatment, right? Be proactive on this. You have to be proactive on it. And one of the most important things you can do to impact your EMR is by having a return to work program that's effective, right? Insurance companies recognize the effectiveness of return to work programs. And more, almost as important, you have to realize the impact on the employee, right? Because injuries are no good. Nobody enjoys being injured, right? And there's many who think, well, they're just sucking it up, they're just trying to get as much out of us as they can. And of course, sometimes that is going to be true. But I would say that's the exception to the rule, not the rule. Most people would prefer to work than be at home making 2/3 of what they would normally make, but not getting that for months, right? So no paychecks coming in, injured so you can't do what you normally do. When the money does come, it's going to be a month or two down the road, and it's only going to be 2/3 of what you normally make. And in addition to that, you're sitting at home, nothing to do but watch television during the day. And what do we see on television during the day? Lawyers' commercials all day, every day, right? That's prime advertising hours for workers' compensation lawyers. What we want to do is get our employees back into work as soon as possible. This really does speed their recovery and lessen your workers' compensation costs. So even if we have somebody doing something that is not in its own beneficial, they are making you money by not raising your EMR. So employee return to work, it's a proactive post-illness, post-injury approach, right? So what we want to do is get people off of the couch, out of their house, and back into the workplace in the safest and most effective manner possible. All right, so return to work. It's not easy. It's not easy getting people to come back in because we have to find something for them to do. We need to make sure that it works, right? But an effective return to work program can discount the impact of a claim on your EMR by like 70%. It's a huge amount. Getting somebody back to work early instead of waiting till they're released to full duty is a huge savings. Okay, so getting them back in is hugely important. We want to make sure that we get them in there. And your documented return to work program can reduce the costs to all affected parties, right? Yourself and for your insurance. You can reduce the negative effects of time away from work. Right? Having that employee away from work really is impactful, right? It speeds their recovery and it allows them to make their full paycheck instead of a partial paycheck that's not coming. That lowers the stress on the household, which also helps to build full health quicker. All right. It's also going to build your morale within your employees. Right? When an employee gets hurt and we bring them back as soon as possible, there's less disgruntlement. We can also help develop more specialized treatment plans, right? When we have the worker on site, we have more contact with them, right? We can have more communication to make sure that they're following through on whatever that treatment plan is, right? Through daily conversations. And it can also help support that provider, right? By giving that additional support to that employee. It can also make it easier for that primary care provider, that medical provider, to make that return to full duty decision, right? By demonstrating that they are able to do that. Normally, a doctor is going to ask the employee, so how are you doing? How's it feeling? What's it like? And when they're laying on the couch with nothing to do, all they have to do is focus on pain, the discomfort, and the lawyer commercials, right? Ideally, we'd rather them have good distraction, right? And productive work. So, in order to do this effectively, you need to develop a light duty bank of jobs, right? A list of jobs that you need done that somebody can do on light duty, right? So, these jobs are going to accommodate injured or ill workers. You want to make sure that, they're pretty basic and clearly outlined, right? Whether that is labeling storage racks in your warehouse, right? Maybe it's just sweeping and cleaning the warehouse area. Maybe it's organizing lighter parts in your tools locker, right? It may be going through your SDS book, which needs to be done on an annual basis. Safety training is a common use of it, but there's not much use to safety training all day long. No one has the focus to pay attention to safety training day after day after day, right? That ends up being just as bad as sitting on the couch as far as lack of distraction and focusing in on the injury, right? So these are not intended to be permanent positions. We can have people review different programs within our safety manual. We can have people look through our SDS book and make sure that all of our SDSs are correct, right? Or copy SDS books and provide an SDS book for each foreman, right? Ideally, we want work that is useful, right? Because nobody likes doing useless work. I do not suggest we sort bolts into one box and then sort them back into that first box. We want to make sure it does not seem like a punishment to the worker, right? We're trying to get them to help. So maybe that means they ride along with whoever it is that's delivering equipment, right? Maybe we go ahead and have them working with apprentices to teach them certain skills. Maybe we have them working with your safety person to review past incidents and see if they can see other root causes for it, right? And I said safety training the whole time isn't any good, but that doesn't mean that you shouldn't utilize some of this time for safety training, right? If we can find good training that they can be a part of that would really help them, that works well. But what you don't want to do is sit them down with toolbox talks 8 hours a day until they're ready to return to work. So when we have a good return to work program, we end up getting employees back to full duty work 3 to 4 weeks earlier than projected, right? And we save that money off of our short-term disability costs and our workers' compensation costs. It really directly benefits that employee, right? It makes it more likely we're going to retain that employee. It increases employees' productivity. When employers take care of their workers, especially when they're in a situation that is not good, such as after an injury, you really demonstrate care for that employee. When you demonstrate care for employees, they're more willing to give you that discretionary effort, right? It really does increase that morale. When you increase that morale, you increase that productivity. You also then don't have to do the training of a new employee if that employee leaves or is not able to return to work, and you can help increase the employee's attendance. So those are some of the direct costs or direct benefits. The indirect benefits is, improved interactions with coworkers, right? When they come back and say, no, they took care of me. I had to sweep for a couple weeks, but I also got some training on suspended scaffolding, which I hadn't had before, which was pretty nice. That's going to improve interactions, right? It's going to improve morale across the board. It's going to improve that productivity, and it's going to improve safety, because now they're talking about that incident, what happened, and really where that benefit is. When we look at total costs associated to hiring a new employee, most the industry average is about $4,000 to $8,000 for hiring, right? So that can be really challenging. Now, for pulling from the hall, we may not have those costs, but we also don't know what quality we're getting out of the hall, right? We don't know what employee we're getting, what their work ethic and what their history is. So really getting that worker back to work is your best option. So common misconceptions that we have. Doctor said my employee can come back, but they need light duty, right? You have to be able to accommodate light duty. It's always good to have that running list. We want to make sure that we have it. What do we do if an employee comes back to work, but they're in pain again from the injury? Right? Make sure we give it time, right? An employee is going to be sore after utilizing muscles that they haven't used before. But if this does not subside, if that soreness does not subside, they need to go back to the clinic, right? Go back to the doctor, and we can reach out to that clinic if we have a relationship and ask them what next steps are. So when you do have an employee that is not open for light duty, you want to make sure you maintain contact. Reach out and talk to that employee, right? Encourage an employee to come into work when they can to help maintain those connections. It is very challenging on a family when there is an injury from work, and your response matters. Okay. You want to be open-minded and willing to consider various options to assist the employee in returning to work, right? That means you might need to be flexible about light duty. You might need to be flexible about offering reduced hours, right? Or providing temporary place to park the car close to where the work is, right? Or close to the office. The list is limited only by your imagination, but the more care you show your employees when they're injured, the better you are going to raise that morale, right? I've been in that situation where I've seen a company not treat employees well after an injury. And really, it makes you think like you're a number. Makes you think that the employer just does not care in any way, shape, or form. And it's all about money. When you have that kind of thought pattern, when that is what the employees think, then they know that production is more important than safety, right? The quality is more important than safety. And their decisions have to be made based on the priorities of their employer often. So they may take chances that they wouldn't if they knew you were more concerned about their safety than you were about the profits. So respond when your employee tells you they're ready to work, and react positively, right? Be supportive of that employee, especially the employees that are injured. They are in a challenging spot. And the better you treat them, the better that relationship is, and how they feel the entire situation happened, the less likely they are to sue, right? If we can keep lawyers out of the situation and keep our employees cared for, we all win in the end. So be willing to consider different options for how to help your employee. Each employee needs different things, right? So don't be afraid to experiment with different things to help employees who have been injured. Not all return to work processes go to plan, right? When we have surgery, oftentimes there is follow-up surgery. Some employees don't respond the same way to some cases. Now, this goes both ways. Sometimes employees heal faster than we thought they would. The injury isn't as bad as initially thought, but it does go that other way as well. Right? Listen to your employee. They know how their body feels. And I know that often management thinks that the employee is faking. Right? Not faking, but maybe exaggerating a little bit to get as much as they can. I know that one point in time I was injured to the point that I had to stop as a union painter and go back to school to become a safety professional. Spent 9 months off of work during that time. I was 9 months on 2/3 pay while I was in significant pain. Nothing that I wanted more than getting back to work and getting out of my house. Understand that most of the employees that you have want to be at work, right? The trades does not attract the lazy. The trades attracts hard workers, right? How do you make it as a union member of IUPAT without a work ethic? I'm not sure. I didn't know many who lasted in that trade without that work ethic. So consider that. If you need help, ask for it. If they need help and they ask for it, do what you can to provide it. And by caring for your employees, preventing incidents wherever you can, building that relationship with your occupational health clinic, you can end that relationship with your insurance company, right? Providing them those programs and documentation. Doing all these things will impact your EMR, right? And not just your EMR, it'll impact the happiness of your workers. All right. So, as always, remember we have the safety helpline at 844-414-SAFE, or you can send in an email to safetyhelpline@finishingcontractors.org, and we will get back to you with a safety professional to help answer your questions as soon as we can. Thank you very much. Have a good day and be safe out there.